to the Megacast. I'm Tyler Keefe in the studios of our flagship stations, Civic Center TV and 89.3 Lakes FM. You can watch Civic Center TV on Comcast, Channel 15 and AT&T Channel 99, where you can also find us live and live to tape on Birmingham Area Municipal Access and City Cable 15 of Southfield. Join us also on Orion Neighborhood Television and the Media Network of Waterford on Channel 10 and on AT&T Channel 99 in their community television and government television guide. You can also visit us on the radio on 88.1 WBFH, the BIF, a service of the Bloomfield Hills School District serving Birmingham, Bloomfield Hills, and Troy. Find us online, civiccentertv.com, by clicking on our Watch Live link. That's going to be in two different places depending on where you're viewing us on the web. If it's on your computer, it's right at the top of our page, the second from the right on our homepage at civiccentertv.com. If you're on your mobile phone and you're on your web browser of choice there, it's going to be in a drop-down menu on the left side of your screen. You'll click on that. The menu will pull out, and at the bottom of that menu, it's the second up from the bottom. You'll click Watch Live to be able to view us on your cell phone as well. You can also find us online on our Facebook pages, Civic Center TV 15 and Lakes FM, as well as on My Michigan TV or MyMy. Go to mymytv.com to learn more about all the places you can view My Michigan TV's imported and original content, such as the Megacast and Steve Leto Live, which airs after us from 12 noon to 1 p.m., and where you can download the MyMy TV app on your smartphone and on your smart TV. And then if you missed any of those places that you can view our show live to tape and on demand, go to our website at civiccentertv.com/megacast, where you can learn more information about all of our partners in each of our broadcasts live and in replay, as well as find all of our shows, the full episodes, and individual interviews on demand. Again, civiccentertv.com/megacast. Right next to that on our website is our coronavirus page at civiccentertv.com/coronavirus, where we have direct links to COVID-19 informational web pages from the Centers for Disease Control and Prevention, the Michigan Department of Health and Human Services, and the Oakland County Health Division. In addition to those links, we have links to many local municipalities in Oakland County, where we originate our broadcast, so that you can learn more about how COVID-19 is affecting business in your hometown, whether that be paying your taxes for your home, whether it be paying water bills or road maintenance or municipal meetings. All of those may be affected by the pandemic, and you can learn more about how that's affecting you in your hometown in places like West Bloomfield, Pontiac, Auburn Hills, Troy, and more by going to our website at civiccentertv.com/coronavirus, where you'll also find many of our top headlines each and every day from across the Great Lakes state. We scoured journalistic outlets all across Michigan to find the top stories on the COVID-19 front and beyond. And making news today, yesterday was Monday when they do release the latest COVID-19 numbers in Michigan. And yesterday, 17,008 new COVID-19 cases, as well as 83 additional virus deaths were reported over that past 3-day reporting period. This from the Oakland Press. Michigan public health officials reported those numbers on Monday over a 3-day period that included Saturday, Sunday, and Monday, as well as additional deaths. Those would be 83 additional deaths in addition to those roughly 17,000 new cases. The 3-day case total brought the state's total confirmed cases to just over 1.25 million cases and just over 23,300 deaths since the onset of the pandemic. Of the 83 deaths reported on Monday, 32 of them were identified during a vital records review. Locally, since Friday, Macomb County has reported 1,808 new cases and 3 additional deaths. In Oakland County, there were 1,986 new cases and 2 additional deaths. And in Wayne County, there were 1,836 new cases and 3 additional deaths. The state's vaccination coverage rate for residents 16 and older now stands at 70.8%, up 0.4% since Friday, with more than 5.73 million residents receiving at least one dose. The vaccination coverage rate for residents 5 and older remains at 60.3%. Faced with spiking COVID infections, Michigan health officials said Friday that they will issue a public health advisory recommending that everyone over the age of 2 wear a mask at indoor gatherings regardless of their vaccination status. Again, a key word in that paragraph there is recommended. This advisory is not a mandate like we saw so many times a year ago from the state, either from the governor's office or via the Health and Human Services Department. This simply is an advisory. It's a recommendation in order to prevent further spread of COVID-19 during yet another major spike here in the state of Michigan. Officials pleaded with people to get the vaccine, a flu shot, and, if eligible, a coronavirus booster dose, as the state finds itself dealing with a fourth surge in cases since the pandemic started. The step came before the holiday season when families in the state with the country's highest per capita weekly infection rate will gather indoors to celebrate. That, of course, as we've learned over the past roughly 2 years, not conducive to preventing the spread of COVID-19. Thus, why the vaccine is being heavily suggested, as well as the health advisory for wearing masks during this upcoming holiday season. The average case rate for Saturday through Monday was 5,669 cases per day. According to the Associated Press, more Michigan schools are now shutting down for the entire week of Thanksgiving, giving staff and families an opportunity to recover from illness, including COVID-19. The decision comes as the state on Friday continued to post the worst new case rate in the United States, according to federal health statistics from the Centers for Disease Control and Prevention. Statistics you can access as well on civiccentertv.com/coronavirus by clicking on the CDC resources. In northern Michigan, Kingsley, Elk Rapids, and Kalkaska schools added Monday and Tuesday of next week to their holiday break. That full article from the Oakland Press posted on our website at civiccentertv.com/coronavirus. And as we head into the Thanksgiving holiday, the Whitmer administration, through the Health and Human Services Department, issues that mask advisory. Again, not a mandate, just an advisory recommendation. Governor Whitmer has said additional guidance, quote unquote, is ahead for Michigan during this COVID surge. This is from our friends at the Detroit News, including Craig Mauger, one of the authors of this article. Michigan Governor Gretchen Whitmer said on Monday she expects her health department to release, quote unquote, additional guidance directed at the state's ongoing COVID surge in the near future. During her first public appearance in Michigan in more than a week, Whitmer said that unidentified hospital leaders she spoke to on Monday were, quote, not encouraging mandates, and closed quote, but were urging public education about vaccinations. The number of adults hospitalized with COVID-19 in the state hit a 7-month high at 3,699 on Monday. The last week, and last week, the percentage of tests for virus bringing positive results reached the highest weekly rate in more than a year. Michigan continues to lead the nation in new cases per population. Quote, if you're congregating with a bunch of people indoors, it's wise to make sure everyone is vaccinated, Governor Whitmer said. She continued on, and if they're not, encourage them to do that. Take this opportunity to tell your loved ones how much you love them and how much you want to spend Christmas with them. It's time to get vaccinated, and closed quote. The governor said she anticipates the Michigan Department of Health and Human Services will release more guidance as the state gets closer to the upcoming holidays. Thanksgiving, of course, is this week Thursday, so we're getting about as close as you can get to the upcoming holidays to make further guidance on this. On Friday, Governor Whitmer's health department issued a public health advisory recommending people wear masks at indoor gatherings regardless of their vaccination status. The state is approaching, quote, the highest number of COVID-19 hospitalizations in Michigan since the pandemic began, and closed quote, according to the statement made on behalf of chief medical officers of Michigan's community hospitals. Last year, during a similar surge, Governor Whitmer's administration used its executive powers to suspend in-person high school and college classes and halt indoor dining at restaurants through epidemic orders. This month, however, Governor Whitmer and her Department of Health and Human Services have relied on recommendations and public calls for vaccinations. Elizabeth Hertel, director of the Department of Health and Human Services, has also declined to impose a statewide mask mandate for K-12 schools. Quote, a year ago, we did not have access to vaccines, Governor Whitmer said on Monday. She continued, we do now. They are easy to get, they're incredibly effective, and they are free of charge, and closed quote. The governor said she is, quote, imploring, and closed quote, school districts and parents to ensure their children are wearing masks. Governor Whitmer took questions from reporters on Monday afternoon after a press conference announcing 100 new jobs and $1 million in expansions of the Crest Marine in Owasso Township. Last week, she was also in Arizona and California as Michigan became the top state in the country for COVID-19 cases per population. In California, she met with the Semiconductor Industry Association Board of Directors to discuss ongoing efforts to increase domestic chip production and attend the association's annual event. That full article from the Detroit News on our website, civiccentertv.com/coronavirus. And as we head into the Thanksgiving holiday, the day before Thanksgiving, often the busiest day of the year for bars, and this from Bridge, Michigan. Poised for Drinksgiving, as it's called, Michigan bars are fretting COVID will dampen the party. Calling the night before Thanksgiving, quote, the biggest bar night of the year, and closed quote, isn't just hype, said Kyle Edwards, taproom and production manager at Grand Armory Brewing in Grand Haven. The annual event, informally known as Drinksgiving, is bigger than the craft brewery's Halloween parties, and it's bigger even than New Year's Eve. The night draws more customers than any other event Edwards can recall in the popular spot in the Lake Michigan vacation town. This year, exclusive beers will be on tap, and a DJ will bring vinyl to entertain patrons. Quote, we're hoping to be busy, end close quote, said Edwards. But the reality may differ from the shoulder-to-shoulder evening in 2019. Many regulars who tend to be age 35 and up are still staying home during the pandemic, and while people may be hungry to get back to normal, the state's bars aren't assured of that being the case on Wednesday. Quote, it's been pretty hit or miss this year, said Edwards. Bars across Michigan depend on Thanksgiving Eve for a boost in sales as patrons celebrate with friends ahead of family gatherings over the 4-day weekend. But this year, as Michigan leads the nation in infection rates and COVID-19 once again overwhelms its exhausted healthcare workforce and at times packs its emergency rooms, health officials are begging people to once again play it smart, mask up, or even stay home. That some folks may pack bars and restaurants this week is mind-boggling to those in public health who have spent the better part of 20 months asking Michiganders to do their part to stay safe. The mantra still hasn't changed. Quote, I have 2 words for you, said Steve Kelso, spokesperson for the Kent County Health Department. Get vaccinated, end closed quote. Beyond that, he and others said mask up, keep your distance, and stay away from others when you are sick. Quote, the script hasn't changed, and it's pretty simple, Kelso said. People are acting like this is over. Take a trip to our data dashboard, and I can assure you it's not. That data dashboard referenced by Kelso is linked in this article that is posted on our website at civiccentertv.com/coronavirus. The state's hospitals, meanwhile, are running at a quote-unquote contingency level of care, meaning delays in patient care and staffing shortages are more routine than usual, said chief medical officers from hospitals across the state, representing large, small, rural, and urban hospitals in a letter issued on Monday by the Michigan Health and Hospitals Association. A year ago, as Thanksgiving approached, Michigan bars and restaurants were ordered to close to indoor service as part of a 3-week quote-unquote pause, effective November 18th, as weeks of escalating COVID cases prompted fears of any gathering ahead of the holiday. Hospital leaders begged residents to cancel routine plans, warning that the, quote, healthcare system can capsize, end closed quote. This year, Michigan faces escalating cases ahead of the year-end holidays once again, with one big difference. Governor Whitmer's administration has declined to mandate statewide closures as it did a year ago, noting among many factors the broad availability of vaccines and booster shots as well. So far as the 4th COVID wave ripples across Michigan, bars and restaurants continue as they have since reopening earlier this year. They're making their own decisions about operating in a pandemic, even as health officials urge caution. Scott Ellis, executive director of the Michigan Licensed Beverage Association, told Bridge, Michigan on Monday that the state's bars and restaurants consider the lack of restrictions good for their industry and point to the low numbers of outbreaks tied to them as evidence that it's working. While most drink businesses don't require servers to be vaccinated, Ellis said they do encourage it. He also said many of his members, most of which are independent owner-operators, are not yet back to pre-pandemic sales levels, especially places that don't offer offer extensive food menus. That full article from Bridge, Michigan, posted on our website at civiccentertv.com, as well as articles summarized and then linked directly to the web pages of these journalistic outlets across the state of Michigan so that you can view those articles in full, read their other articles, and of course we always encourage you to subscribe to support local journalism all across the state of Michigan. All that again on our website, civiccentertv.com/coronavirus. We have a great Tuesday edition of the show ahead of you as we head into the Thanksgiving weekend. You're looking for some places to eat either the day of or the day before or over the weekend after Thanksgiving. We'll be joined next by Sue Selasky. She is the food writer and reporter over at the Detroit Free Press. She will join us at 10:20. At 10:40, Barb Giles will join us. She's the Executive Director of Strategic Initiatives at Jewish Senior Life. At 11 o'clock, we'll kick off the second hour of the show talking to one of our great nonprofits, Timothy Paul, the co-founder of Detroit Hives, will join us on the show. And then Gerard Baltrusaitis, the JVS Human Services Career Counselor, will join us at 11:20. And we'll end off the show at 11:40 with Courtney Smith, the founder and CEO of the Detroit Phoenix Center. That is all coming up next. You are watching and listening to the Megacast.
We may come from different organizations,
but we work together to protect the Huron River for everyone.
Neighborhood storm drains carry water directly to local creeks and streams. No filters, no treatment.
Storm drains also help reduce street flooding when it rains.
So clearing storm drains and the areas nearby of trash and leaves helps keep them for rain only.
It is easy to do your part by adopting a storm drain.
Find a storm drain, check it, and clear it every month.
So keep storm drains for rain only.
There's one water, and it's ours to protect.
If you are struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to a $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit or call toll-free at 833-511-0311.
A public service announcement from 89.3 Lakes FM.
We as Michiganders feel connected to this resource in a way that I think is really powerful.
Conservation starts with a caring, committed community.
For me, it's peaceful to have a relationship with the river.
Every single one of us has a role to make sure that those waterways stay safe and healthy, being careful about what goes down the storm drain.
Just even eliminating some of your single-use plastic makes a difference.
There's one water, and it's ours to protect.
Did you know that nearly 3.31 million Americans don't get their annual checkup? Going to the doctor regularly is extremely important and is a crucial factor in maintaining good health. Make sure you are visiting your local doctor often and telling them about any health concerns you have. For more information, contact your local healthcare provider. This message is brought to you by WBHS Digital Media Arts Program and 89.3 Lakes FM.
People are getting out to walk and bike in higher numbers. More vulnerable road users and higher speed traffic can be a dangerous combination. Crash severity has increased, so if you're driving, be sure to slow down and look for people. There's no need to speed. If you're biking, ride with traffic. If you're walking, avoid stepping into the road if possible. If you have to walk in the street, walk facing traffic. Learn more at walkbikedrivesafe.org.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
How can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources, call 211 or visit 211.org. 211. Get connected, get help.
Welcome back to the Megacast. I'm Tyler Kieft in our studios here in West Bloomfield Township, although we're broadcasting all throughout the state of Michigan on a number of different outlets, on TV, on the radio, and on the web as well. Learn more information about all the places that we broadcast live and live to tape from 10 a.m. to 12 noon, Monday through Friday, by going to our website at civiccentertv.com/Megacast, where you can also find all of our interviews on demand as well as our full episodes also. Joining us now, our first guest today. Joining us is Sue Selasky. She is the food writer and reporter over at the Detroit Free Press, with us to talk all about Thanksgiving dinner and options over this next weekend ahead of us for those of you that want to go out on the town and visit some great restaurants in the Detroit area. Sue, thanks for being with us today.
Thanks for having me. Good morning.
Appreciate having you on. Good morning to you as well. So, of course, we're in the thick of the holiday season here. We're approaching quickly the Thanksgiving holiday. You actually just really recently wrote an article called 10 Common Questions About Thanksgiving Cooking Answered. And so let's go through some of these questions because we're getting close to the holiday. People are getting ready to prepare Thanksgiving meals, whether it's they're doing it kind of for lack of better terms, piecemeal between the family or all in one location. There are always a lot of questions, especially for those that are first-time turkey cookers. The first one that's on your list, I think, is a really good question that I'm sure many would have. I forgot to thaw my turkey. What should I do? If someone hasn't thawed their turkey out yet, and here we are, we're less than 48 hours away from the holiday. What should they do?
Well, it's one of the top questions that comes up. People, they just forget to thaw the turkey. Now, the best way to thaw the turkey is in the refrigerator, and you need to allow a few days. A 15-pound turkey will take 3 days. So if you forgot to thaw, you can do it in a cold water method, and that's, in a clean sink. Submerge the turkey in breast side down in its original packaging. That's really important. And in the sink, cold water, submerge it. But you have to change the water every 30 minutes. So a 10-pound turkey will take a good 5 hours to thaw this way.
And so if someone is trying to thaw the turkey out even quicker, maybe it's the day of and they haven't taken and done any thawing whatsoever, can they cook a frozen turkey?
You can. It's quality. The quality. It'll take longer. That's the big thing. It will take much longer than normal. You're gonna have to allow like a good 50% more cooking time. You can do it. Quality may suffer a little bit, but it can be done.
So a lot of people will want to cook stuffing. It's a common side on Thanksgiving holiday. Some people like to cook the stuffing inside of the bird, and others will choose to do so separately. If they want to cook the stuffing inside the bird, when should they stuff the bird before they cook it?
Well, ideally just before you cook it. There's a lot of should you stuff it? Is it safe to stuff it? Is it not safe to stuff it? And so if you don't want to pack it, you just want to loosely stuff the turkey, just before you're getting ready to put it in the oven. And the key is making sure that stuffing, the internal temperature, the center of that stuffing reaches a temperature of 165 degrees.
We're joined by Sue Selasky. She is the food writer and reporter over at the Detroit Free Press, joining us on the Megacast, talking all about food and restaurants this Thanksgiving holiday. We're answering many of her questions from 10 Common Questions About Thanksgiving Cooking Answered, her article recently posted in the Detroit Free Press. And another key question here, especially for those that may be cooking a Thanksgiving dinner for the first time and be cooking a turkey for the first time. How do they know when the turkey is done?
Well, the biggest thing to do is invest in an instant read thermometer. You can pick them up at hardware stores, big box retailers. But that turkey, the whole turkey, it used to be that the USDA wanted one temperature for the breast and one temperature for the legs and thighs, and that just about overproduced. The breast meat would be dry. So overall, you want to cook the turkey to 165 degrees on an instant read thermometer. It's really important to have that thermometer, and once you reach that temperature, you want to let the turkey rest a good half an hour before carving.
We're joined by Sue Selasky, food writer and reporter over at the Detroit Free Press, joining us on the Megacast. And so during the Thanksgiving holiday, we hear a lot about brining as something that's done in the preparation of the meal. What is brining, and what does it add to the Thanksgiving meal?
Well, there's two types of brining. There's a wet brining and a dry brining. And the wet brining is soaking the turkey in a salt water solution, usually about 2 gallons of water, minimum 2 gallons of water to 2 cups of kosher salt. And what that does is it allows this seasoned moisture to get into the cell walls of the turkey. And during cooking, that will steam and release. And it just ensures that you're going to end up with a moist turkey. You can also dry brine it by, salt and some seasonings, and that is, rubbed all over the turkey and let set for typically overnight. Most brines, wet or dry, most recipes will call for brining for at least 24 hours.
We're joined by Sue Selasky, food writer and reporter at the Detroit Free Press, answering many of our questions about Thanksgiving dinner cooking, as well as other restaurant options throughout the Metro Detroit area this holiday weekend. If you have many questions that you have about Thanksgiving dinner cooking can be answered in her article, 10 Common Questions About Thanksgiving Cooking Answered, that you can find on the Detroit Free Press's website at freep.com. Again, that article on freep.com, 10 Common Questions About Thanksgiving Cooking Answered. Again, we're joined by Sue Selasky, food writer and reporter at the Detroit Free Press. And so during the Thanksgiving holiday, if people either are not prepared to cook or some disaster happens with their Thanksgiving dinner, as sometimes unfortunately happens to people, what sort of restaurant options are available in the Metro Detroit area for Thanksgiving meals, or even just a good, uncommon Thanksgiving meal that will be of quality for a family this season?
Well, many restaurants are open this year. As we all know, they were not open last year or they were open for carry-out only Thanksgiving. And for years, prior, just about, not every restaurant, but many restaurants were open for Thanksgiving dinner buffets. They had sit-down meals. And so there's quite a few in the metro area who have opened, who will be open for sit-down service or carry-out. And you'll need to make a reservation. Just, check with your local restaurant that may have had it Thanksgiving in the past. There's also the option of to-go from the restaurants, and there's to-go from grocery stores that many major grocery stores and independent grocery stores in Metro Detroit have complete meal options that you can order.
We're joined by Sue Selasky. She is the food writer and reporter at the Detroit Free Press, joining us today on the Megacast. You can learn more information about all of her articles and read them on the Detroit Free Press's website at freep.com. And so for those that are looking for interesting dining options throughout the Metro Detroit area this holiday weekend, whether it be on the Thanksgiving holiday itself or in the weekend thereafter, what are some of the more interesting options that are available here in the Metro Detroit area, or some of the newer restaurants that may have popped up in the last several months or in the last year that people may be interested in visiting this weekend?
Well, there's several. There's several in downtown Detroit that are open for Thanksgiving. Oak and Reel is giving it to go, has a to-go option. Some of your hotels, the Rugby Grill has a sit-down option. Many of the Andiamo locations are offering Thanksgiving to go. There, you just need to check with your local place. There's several in Macomb County. Ernie's has a big menu for Thanksgiving. Just, check with your local restaurant, and they may or may not be open.
A couple of those restaurants that Sue just mentioned, the Rugby Grill in Birmingham, their hours 7 a.m. to 9:30 a.m. for Thanksgiving brunch on the day of Thanksgiving, with seating times at noon, 3 o'clock, and 6 o'clock as well. Learn more information at Rugby Grill. That is Rugby Grill with an E at the end of grill.com. Another one she mentioned was Ernie's in Clinton Township. Their Thanksgiving Grand Buffet served 1 p.m. to 7 p.m. $42.95. 11 and under, $11.95, and under 5 are free. And you can learn more information on their website by going to erniesmi.com. That's erniesmi.com. We're joined by Sue Selasky, food writer and reporter with the Detroit Free Press, joining us on the Megacast. And so, Sue, with the COVID-19 pandemic still a concern, still a factor here in the state of Michigan, now even more so with this current surge that's going on, has suddenly become even more severe here in Michigan. How are the restaurants responding? How are they feeling at this moment in time? Are they nervous that this surge continues further? They could see some further shutdowns.
Yeah, I'm really, not sure. I know there's been, talk of more mandates, but I'm not sure. Those are just things that I've heard. Restaurants have taken precautions during this entire time too. Social distancing, hand sanitizer, masks, acrylic glass in some places. So I think right now I'm really not sure exactly what they'll be doing.
We're joined by Sue Selasky. She is a food writer and reporter at the Detroit Free Press. Joining us today on the Megacast. Sue, just another few minutes with you before we'll say goodbye today. Anything else that would be interesting for our audience to know about the restaurant industry here in Metro Detroit, or other options that may be available for people that they should be considering for themselves or for their family this holiday weekend?
Well, I think one thing is, the restaurants, they still have plenty to go. A lot of restaurants have pivoted to more to-go options, and so have the grocery stores. There are plenty. There's stores there's stores that are open on Thanksgiving Day. Your independents, and your bigger chains, Kroger, Meyer. That they not only will they have a complete meal that you can order in advance, but they also have individual meals that you can go in and buy if you just want an individual Thanksgiving meal, and that's a big option there. A lot of your bakeries too will have, if you're missing a pie or dessert, you order your pies and everything like that. So I think one thing that I would mention about the Thanksgiving meal, another big question that comes up is making mashed potatoes in advance. It's one of those things that you always have mashed potatoes for Thanksgiving. And one of the things that I like to do is you can make them a couple hours in advance and just keep them warm in a slow cooker.
We're joined by
and they'll be fine. Yeah.
Please continue.
No, I'm just saying that if you can keep them warm for a couple of hours on the low setting in a slow cooker, you might have to add a little bit of butter or maybe a little extra cream to it, but they'll hold just fine. So you're not making them last minute.
We're joined by Sue Selasky. She is the restaurant and food reporter over at the Detroit Free Press, joining us on the Megacast. Sue, thank you very much for joining us today.
Thank you. Happy Thanksgiving.
You as well. You can read all of Sue's articles, including the 10 common questions about Thanksgiving cooking, answered, as well as Thanksgiving restaurants. Here's where to dine out, by visiting the Detroit Free Press's website at freep.com. We're going to take a quick break. On the other side, Barb Giles from Jewish Senior Life will join us to talk about how you can spot signs of need in your in your loved ones, particularly in parents and older adults, as you visit with them this Thanksgiving holiday and throughout the rest of the holidays this upcoming season. That's coming up next. You're watching and listening to the Megacast.
Parents do a lot of worrying. Get your kids caught up on childhood vaccines to protect them from these 14 preventable diseases, and you'll have 14 fewer things to worry about. Vaccines are safe and effective and save lives. So let's get caught up on vaccines and worry about something else. Get the facts at ivaccinate.org.
We may come from different organizations,
but we work together to protect the Huron River for everyone.
Most of the pollution that goes into our rivers is carried by rainwater that flows off of roads, parking lots, and rooftops.
The leaves and bark of a single tree can retain a surprising amount of rainwater. Depending on its size and species, it could be 100 gallons or more.
It is estimated that an urban forest can reduce annual runoff by up to 7%.
Here's one thing that we know can help keep our water clean:
plant a tree.
Plant a tree.
Plant a tree.
There's one water, and it's ours to protect.
One of the things you can look for in your friends is a change in behavior. These can be big changes, they can be small changes in mood, physical appearance. They may be sleeping less or sleeping more, drinking more, or their eating patterns may be different. One big change that can be pretty obvious is change in motivation. Do they no longer want to play basketball? Do they no longer want to play video games? Now that we're spending more time online and in virtual settings, it's really important to pay attention to the language that your friend is using and the words they're using to communicate.
So when we text our friends, are they taking longer amounts of time to respond? Are they not responding at all? You don't have to be an expert to try to recognize these signs. The second that you feel it in your gut and that you're concerned, that's the second to have the conversation and open the door to what might be going on.
Today, it is easier than ever to join Michigan's Organ Donor Registry and help build a bridge of hope for organ, tissue, and eye donation. Just one person can potentially save or help improve the lives of up to 75 people. By joining, your legacy could be the gift of life. Sign up today at michigan.gov/SOS or at any of the more than 145 Secretary of State self-service stations located across Michigan. Be part of Michigan's Bridge of Hope by adding your name to the Organ Donor Registry.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
211, how can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources, call 211 or visit 211.org. 211. Get connected, get help.
Welcome back to the Megacast. I'm Tyler Kieft here in our studios in West Bloomfield Township. Although we're broadcasting all throughout the state of Michigan on different outlets such as My Michigan TV and more. Learn more information about everywhere that we're broadcasting live and live to tape by visiting our website at civiccentertv.com and clicking on our Megacast link. Joining us now is Barb Giles. She is the Executive Director of Strategic Initiatives at Jewish Senior Life to talk about how we can help our older adults and our seniors this holiday season as we visit with family and with friends over the Thanksgiving and the other holidays. Barb, thank you for being with us today. Appears you are muted. Just a moment.
Thank you for having me.
Appreciate it. Good to see you. Good to hear you. On Jewish Senior Life, they recently released a list of signs of need in parents and older adults. Some of the ways that we can, things we can look out for to see if our older adults and our seniors and our families and even our friends may be in need if we haven't seen them in a while and maybe their circumstances have changed in a way that we're unaware of. What are some of those key signs that families should be looking out for in their older family members and their senior family members?
So evaluating your loved one during the holiday season this year is particularly important because some of us haven't necessarily been in person with our loved ones since the last holiday season. So I think there are 5 key tips that individuals who are seeing their loved ones for the first time, 5 things that they can do to evaluate any changes that might have happened with an older adult since the last time they were together. So my first suggestion is that if this is someone who you feel is safe to come in physical contact with and that it's safe for both of you, that if you are able to greet each other with a hug, or if you're not having physical contact because of your COVID concerns, to look for changes in physical appearance. Weight loss is indicative of a whole many variety of things that could be happening behind the scenes for older adults.
Weight loss can happen because of financial concerns, that people are not spending money on groceries. They could have social reasons that they're not going to get groceries, especially now. Maybe they're even having difficulty cooking. So when you see somebody and you can even feel them when you're able to hug them, that is certainly a sign. Also, when you're able to look for changes in appearance, decreased mobility is a huge indicator that perhaps something is going on and a visit to the doctor is warranted. Also, unkempt or mismatched or unclean clothes, another good sign. These are just signs that something has happened under changes in appearance. The second tip I can give is take time to sit and listen and notice possible changes in personality. Are they asking the same questions over and over again? Are they getting not able to follow basic directions that perhaps you've given them? Or are they getting confused at times to people, places, and things? This is another sign that something may have changed for your loved one. A third way you can evaluate your loved one is to ask about their friends. You can talk to them about their social life. Right now, it's sort of hard to gauge someone's social life because of ways we are changing things because of COVID. But if you notice there's a lack of interest in things that they were previously interested, another sign that maybe there's a change. The fourth tip, and really almost one of my favorite tips, is to act like a nosy neighbor and look for changes in the home. This is a huge indicator that something has changed for an older adult. Is there more clutter than there used to be? If you rifle through their mail, are they not paying attention to their bills? If you open the refrigerator, this is another sign, a great indicator of expired food, spilled food, things that look yucky, that you don't think that they're not paying close enough attention to things. Are there multiples of the same item? Every time they go to the grocery store, are they buying the same thing over and over again that they're not remembering that they might have already bought it? Another sign of in the nosy neighbor is that you can look for signs if there's been a small house fire that maybe you didn't know of. Are there burns on the knobs or pot bottoms of some of the pots and pans? Or the other telltale sign is burnt pot holders with burnt edges, another sign that perhaps something has happened. Now, we all have small fires. Believe me, if you check my house, some of my pot holders look like that too. But these are all signs that maybe are building up towards something altogether. Also, what do their pets and houseplants look like? Are they remembering to water their plants? Are they remembering that to take care of other things? These are all great signs. And my fifth tip for evaluating your loved one during the holiday season is to take a walk or go for a ride with the older adult. Do you notice any new nicks or dents in the car since you last rode with them? Maybe they're getting in accidents and you don't know. Are they remembering to fasten their seatbelt when they get in the car? When you turn on the car, are you notice that some of the warning lights have been on and you're getting a low pressure sign that perhaps has been there for a while? Are they tailgating? If you feel it's safe to ride, are they tailgating? Do they follow the speed limit? And are they having any trouble confusing brake and gas? If not, you can go for a walk with them also and check their balance. Are they steady walking? Do they shuffle when they walk? All of these are possible changes. So those are my 5 tips for evaluating your loved one in the holiday season.
We're joined by Barb Giles. She is the Executive Director of Strategic Initiatives at Jewish Senior Life, joining us today on the Megacast. And so, Barb, if you are noticing those signs and you have some concerns, what are the next steps that should be taken after you've identified some of these concerns to either address them with your loved one or even take action if they're severe enough?
The first action to take is always to evaluate your loved one medically. Take them to the doctor. You don't know when the last time perhaps they might have gone to the doctor is, or even something as simple like a urinary tract infection for an older adult can cause great confusion that is very temporary. And after a couple of doses of antibiotics, someone's back on their feet again and not showing that same confusion. So the first thing to do is to always have your loved one evaluated by a medical practitioner. Once that's happened, perhaps that person can give you more guidance if it is time to consider changes, or if other options or supports are needed in the home. These are always great ways as your physician to really help be your guide as to what's going on and what other steps might need to be taken.
We're joined by Barb Giles. She's the Executive Director of Strategic Initiatives with Jewish Senior Life, joining us today on the Megacast. And so, as we are in the holiday season, and we are going to have gatherings of families during the Thanksgiving holiday, over Thanksgiving weekend, and certainly in the holidays in December as well. Having those evaluations is one thing. It's important, but also it's important to create an environment that is welcoming and that is safe all across the board for our seniors and for our older adults as well. Having those big family gatherings, they can be noisy, they can be compact, and that can be stressful for a lot of people, especially our older adults and seniors. What advice do you have for families to help to mitigate that situation this holiday season?
If you're noticing your loved one is becoming overwhelmed with the amount of people, especially after the isolation we've all had, social isolation because of COVID, to really simple strategies like taking the older adult to a room with fewer people. There's always one room, maybe the den or the living room, where fewer people are gathered and maybe the television isn't on, where you're limiting some of that outside noise and where you're able to make some changes for the person, because being overwhelmed is very anxiety provoking. So the easiest tip would be to take the person into an area of a lot less people congestion, where I still should remind everyone, we all want to be very careful with the climbing COVID numbers. So even please use great caution while you're with your loved ones over the holidays. And I believe our Oakland County is even advising masks being worn inside for family gatherings. So you might want to make some other changes depending on how large your group is that can help the person.
We're joined by Barb Giles from Jewish Senior Life. She is their Director of Strategic Initiatives with us today on the Megacast. And in terms of COVID-19 precautions that should be taken, what are the immediate factors that should be put into consideration before either inviting older adults and seniors in your family to these family gatherings, or inviting others to these gatherings that may include these individuals?
So Michigan Department of Health and Human Services' #1 suggestion is vaccination. Vaccination is critical in helping us to control the COVID-19. After that, certainly good practices include frequent hand washing, disinfection and cleaning of high-touch surface areas. Masking, even while you're indoors, is currently recommended. All of the good COVID-19 practices, covering your mouth and nose if you're sneezing, all of those good practices that we've been following, good hand washing, I would stress the importance of making sure we're doing all of those things while we're visiting with our loved ones.
We're joined by Barb Giles, joining us today on the Megacast. She is the Director of Strategic Initiatives with the Jewish Senior Life. And during the season also, we got to think about our caregivers as well, because they've been with our older adults, with our seniors throughout this entire pandemic. It's been a challenging year and a challenging process for them through all of this as well. What further considerations should we be taking at the familial level for our caregivers also during this time?
Right. So caregiver burnout is a huge factor to consider. Almost 72% of family caregivers report not going to the doctor as often as they should for themselves. And 55% say they completely skip their own doctor's appointments. So taking care of yourself is critical in order to take care of your loved ones. It is really critical. Caregiver burnout is a real thing. And for those of you who have been taking care of somebody you love, especially during this pandemic, it's really critical that you are taking care of yourself. Some signs that you should be looking for that you're suffering from caregiver burnout is, do you have a lack of energy? Are you sensing an overwhelming sense of fatigue? Are you having sleep problems? Are you feeling like caregiving is controlling your life? Are you struggling with anxiety, depression, inability to concentrate? If you are not able to be the foundation to take care of the person that you're taking care of, your whole situation will crumble. You have to have the strong foundation. So at Jewish Senior Life, some of the things that we recommend is, it is critical for caregivers to ask for help. You are not a failure if you need help. So let other people know that you need their help and support, and give yourself permission to take breaks. And if it's not safe for you to take a break, maybe there are other things you can consider, like an adult day program, like we have at Jewish Senior Life at our Brown Adult Day program, that if you need a few hours of respite, excuse me, there are programs to help you so that you can get the care and do some of the things that you need. How about just waking up 15 minutes earlier to spend some time for yourself, where maybe you can journal, where maybe you can meditate, and you can have some time. Maybe it would be helpful for you as a caregiver to make a list of what you need to accomplish during the day so that you can make sure your needs are being met. I'm just going to grab a drink of water so that I don't choke to death.
Okay, yeah, I will then reset. We're joined by Barb Giles. She is the Director of Strategic Initiatives with Jewish Senior Life, joining us today on the Megacast, talking about what we can look out for in our seniors and our older adults and our caregivers this holiday season. And so, Barbara, as we do our evaluations of our family members, of our caregivers, particularly of our older adults and seniors, one of the toughest things that a family can do is reach the point where they realize they need to make some changes in the lives of their loved one, and they need to make those changes themselves without it being necessarily being the direct decision of that loved one. What advice do you have for the families that may be going through that pretty common struggle this holiday season after they've done their evaluations?
So one, there are professionals to help you. If you're making the decision that the current situation needs to change somehow, not necessarily for the person to move, but to change somehow, there are wonderful professionals in our community. Here at Jewish Senior Life, we have our own frontline resource by calling 248-661-1836. And our person who answers our telephone, Tracy Perkovnik, can help guide you. And there are navigators like that all over. And at places like Jewish Senior Life, we welcome people of all beliefs, faiths, nationalities to call us, because we will help guide you. And there are other wonderful resources in our community of case managers and other practitioners who make it part of their business to help people find more support when a time has come to make a change. Maybe the change is simple. Maybe the person just needs home care services coming into their home. Maybe the person just needs 4 hours of somebody coming in and helping with some light tasks. Maybe the person needs physical therapy services coming into the home. Maybe you're deciding it's time to leave the home, and there are choices like independent living communities that offer supports. There are assisted living communities that offer tremendous supports. So there are resources, and people often make dramatic thoughts that they have to make some kind of radical change, when sometimes just by building in enough supports, you can make the change, or by moving someone to an independent living community that offers enrichments, you can build enough support up to help that person move forward with just a small change in their environment. So It's always not the most dramatic thing, but there are professionals to help everyone.
We're joined by Barb Giles. She's the Executive Director of Strategic Initiatives with Jewish Senior Life, joining us today on the Megacast. Barb, just another few minutes with you today before we'll say goodbye. Any lasting advice or other considerations that should be made by families or individuals this holiday season regarding their older adults, seniors in their life, or caregivers?
One, please know everyone needs help, and there are wonderful places that are here to help all of you. This time of year is tremendously difficult, and I think this year maybe even more so than most, that the challenges and things that we will encounter after not being together for so long will really start to that you'll start to see maybe different pictures. So don't get overwhelmed. Make sure that you're taking care of yourself as the caregiver. Make sure that you're evaluating the people who need evaluating, and call for help, because we're here to help you.
Well, Barb, we appreciate your time. Thank you for joining us and giving these families some needed advice and guidance on how they can help their loved ones as we head into this holiday weekend. Thank you.
Thank you.
Appreciate
Have
it.
a happy holiday season.
You as well. Barb Giles has been joining us, Executive Director of Strategic Initiatives at Jewish Senior Life. We're going to take a quick break on your radio homes for the Megacast, 89.3 WBLD Orchard Lake and 88.1 WBFH Bloomfield Hills. After the break, we'll be speaking with Timothy Paul. He is the co-founder and director of Detroit Hives, a 501c3 nonprofit working with bees in the neighborhoods down in Detroit. He will join us next. You're watching and listening to the Megacast.
If you are struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to a $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit, or call toll-free at 833-511-0311.
A public service announcement from 89.3 Lakes FM.
Whether you're the city,
the county,
or the Huron River Watershed Council,
we work together to protect water resources for everyone.
Most of the pollution entering our rivers is carried by rainwater that runs off roads, parking lots, and rooftops.
A rain garden helps catch stormwater runoff.
Rain gardens and their plants help dirty runoff soak into the ground.
You can do your part to help keep our water clean.
Learn about rain gardens and native plants.
So consider a rain garden in your home landscaping.
Catch the runoff with a rain garden.
There's one water, and it's ours to protect.
I couldn't breathe at all. There was lots of talk about putting me on a ventilator. I thought I was gonna die. I was 39 weeks pregnant and had a scheduled C-section. During that time, I got COVID and was hospitalized for a month. I had a blood clot in my lungs. It caused me to go into right-sided heart failure. I was really scared. I kept texting my husband and my mom, telling them how scared I was, and I was worried that he was gonna grow up without a mom. And then I was worried if, when I did get home, that he wouldn't know who I was. You know, being 27 and a mom and a wife, and having that all almost taken away from me. It's scary, and if a vaccine can prevent that from happening, why not? Get your vaccine. I don't want this to happen to anybody else.
Timothy Paul, the director of Detroit Hives, is with us now. Timothy, thank you for being with us.
Awesome. Great to be here. Thank you for having us.
Appreciate having you on. So you're a 501c3 nonprofit organization. Tell us about Detroit Hives and some of the work that your organization does.
Absolutely. Detroit Hives is a 501c3 nonprofit organization whereby we were founded in 2017. And we were set out for a mission to improve communities for both people and pollinators by transferring vacant lots into urban bee farms, but also into pollinator habitats. Since we started in 2017, we now exist in over 20 locations. And we work to partner with the City of Detroit, Detroit Land Bank, Wayne State University, the Ford Resource Engagement Center, Gleaners Community Food Bank, the list goes on. And we're managing over 50 honeybee hives right here in the city of Detroit. In addition to that, we're on a mission to educate the next generation of leaders in sustainability. With that being so, we implemented an educational program entitled Be the Change, whereby we've already educated and exposed hundreds of inner city youth on the importance of bee conservation right here in the city of Detroit.
We're joined by Timothy Paul. He's the director of Detroit Hives, a 501c3 nonprofit organization supported by Share Detroit. You can learn more information about all the other Share Detroit charities and nonprofits that they support, as well as Detroit Hives, and find out ways to volunteer, to donate, and to support with other products that they may need by going to sharedetroit.org. So how many farms do you currently have? How many hives do you currently have in the city of Detroit, and just how many bees does that equate to?
Very good question. So we currently have 48 hives directly in the city of Detroit, and then outside of Detroit, of course, we have hives in Pontiac, Michigan, and other areas throughout southeastern Michigan. But in Detroit, we have 48 honeybee hives, and what that equates to is you're looking at roughly somewhere between close to about, I would say about 8 million honeybees that's floating around here in the city of Detroit.
We're joined by Timothy Paul, director of Detroit Hives, with us today on the Megacast. And so there are a lot of misconceptions about bees. Some people know just like the basic facts about them. They're pollinators. Their peak seasons tend to be in the warmer months of the year. They're roaming around and they're helping with our plant life, of course. They're, of course, producing honey in their hives in some cases. But what are some surprising facts that people may not know about our bee populations here in Detroit and the metro area?
I would definitely say that due to the increase in green space or vacant lots here in the city, that it's been boosting not only native bee populations, but also been very supportive with honeybee populations. And in return, with so much of the green space, it's been providing food security for our pollinators. See, what most people don't know or may not be familiar with is that the #1 decline in pollinators or any type of insect or wildlife is a lack of habitat. So with so much green space that's providing or that's somewhat creating urban jungles, it's been providing pollinator habitats, and it's been supporting biodiversity and inclusion here in the city of Detroit. You know, in Michigan, it's home to 467 native bees.
We're joined by Timothy Paul. He is the director of Detroit Hives, joining us on the Megacast. So you gave us a little bit of an idea of how many hives you have throughout the Detroit area, how many bees that does include. But what are some of the locations that these hives are at?
Right. So some of our premier locations include the Wayne State University Computer and Information Data Center, Michigan State University Detroit Partnership, located right in Brightmoor. We have hives at Gleaners Community Food Bank, the Ford Resource Engagement Center. But let's start with our very first project, the East Warren Apiary, whereby we transform a 10-year-old abandoned vacant lot that now serves as an outdoor educational hub. In essence, an educational apiary whereby we hosted well over 800 tours right here in the city of Detroit, locally, nationally, and internationally.
So for you, you're the director of Detroit Hives, but you also are one of the founding people of the organization as well. What inspired you to begin Detroit Hives?
Well, it all started from an article that I came across around the summer of 2016. The city of Detroit put out a call to action where they were looking for residents like myself, nonprofit organizations, or community block clubs to buy back many of its vacant lots. See, at that time, the city of Detroit currently had over 90,000 vacant lots, and they didn't have a budget to tend to these vacant lots. And it was causing issues around our community, issues pertaining to poor mental health, blight, crime, and violence. And I took this as an opportunity to give back to our community because there was so much work happening in the downtown area. I felt like our inner city communities were being left out of that conversation. So it sparked an idea to want to do something. So we knew in order to change the narrative of what people thought about the inner city communities or pertaining to what they thought about the people that resided within the communities, we had to do something that was game-changing, out of the box, or completely a new model. Originally, we thought about creating a peacock farm, an outdoor photography studio, or urban campsite. All of these were great ideas that we had on our vision board, but we really didn't act on them. Until later that year, December of 2016, I was undertaken with a really bad cough and cold that I tried everything to get rid of. I pretty much just threw in the towel and gave up until I came across the power of local raw honey from a store right here in Ferndale, Michigan, called the 9 Mile Hilton Market. From there, the store owner educated me on local raw honey, its importance, and it got rid of my cough and cold. My partner, Nicole, began to see my interest in learning more about local raw honey. She made a very simple suggestion. She said, how about we transform a vacant lot into a honeybee farm opposed to other ideas that we were thinking about? And that's where the idea began, where we pollinate Detroit hives.
And so how many vacant lots in the city of Detroit have been converted since you bought your first, you and your partner Nicole had bought the first lot back in 2017. Since then, how many have been then converted into a bee farm in Detroit?
Very good question. We've been able to successfully convert over 5 vacant lots right here in the city of Detroit, working to create a social, environmental, and financial impact in our community.
So when you say you convert these lots, what does that process entail to be able to go to these vacated lots in the city and transform them into exactly what you said, a location for these bees that's both ecologically constructive to the community and constructive in general to the community environment as well?
Yes, there's a lot that goes into converting a vacant lot. For one, depending on what site you choose, you must convert, or I would say conduct a land survey. But in addition to that, we're talking about community development. You just can't put hives in locations without working with the community. You have to create a hive within this space. So the first thing you need to do is really communicate with your community, find some local partners to be a part of this project. In addition to that, what we've been able to do is form partnerships right here in the city of Detroit that allow us to buy back the vacant lots in the city of Detroit.
We're joined by Timothy Paul. He is the director of Detroit Hives, joining us today on the Megacast as part of our Shared Detroit charities and nonprofits of the day that we're doing Monday, Wednesday, and Fridays at 10:20 now through November 30th as we approach Giving Tuesday. You can learn more information about Detroit Hives and other opportunities you may have to join them in their activities and, of course, to donate to their organization by going to DetroitHives.org or by visiting ShareDetroit.org. as well. Again, we're joined by Timothy Paul, who is the director and one of the co-founders of Detroit Hives. And so, Timothy, when you do establish a hive on one of those vacant lots in the city of Detroit, beyond the ecological benefits that it brings to that environment in that area of our world, from a community standpoint, what benefit do these hives bring to their area of the Detroit community and to the broader community in Detroit?
In essence, let's start with food security. Pollinators are responsible for 90% of the foods that we eat today. Pollinators consist of butterflies, honeybees, native bees, ants, even wind serves as a pollinator. According to the Detroit Food Policy Council, they estimate that 48% of all Detroit households are considered food insecure, meaning that most residents only have access to fast food restaurants, gas stations, and liquor stores. And according to the USDA, they report that when you have these limited options of food choices, you're more likely to be prone to chronic illnesses like COVID-19, heart disease, diabetes, even depression. So by reactivating these vacant lots, it not only help reverse mental depression or mental disorders by seeing beautified projects, but it also works to provide food security, which provide better for your health. So what it does is when you have a habitat that provides food for pollinators, in return, pollinators help provide food for us. So we get an opportunity to work with local urban gardens, farmer markets, but also restaurants to provide a local raw honey and beeswax candles, in which provides respiratory or immunotherapy support.
We're joined by Timothy Paul. He is the director of Detroit Hives, joining us today on the Megacast. You can learn more information at DetroitHives.org to learn more about all the work that they're doing and, of course, ways that you can help the organization as well. And so, Timothy, we know that during the pandemic of the last 20 months plus, that our nonprofits have had a really tough time certainly on the financial side of things in a general sense, but also continuing their operations also in some ways and in others. It varies from charity to charity, from nonprofit to nonprofit. But at this time, in terms of what the community can do to support your organization, what are Detroit Hive's greatest needs at this moment in time that our community can help to provide?
Right now, to continue our ongoing mission, we have a goal of transforming or revitalizing 5 additional vacant lots throughout the course of 2022 to 2023. And we're working to revitalize a vacant commercial parking lot that sits at 32,000 square feet. And we're going to transform that particular parking lot into the State Fair and Hoover Pollinator Parkway. We've already raised over $48,000, and we're looking to complete our estimated budget of $70,000. So we're looking for donors, we're looking for volunteers and supporters to help be a part of this project.
We're joined by Timothy Paul, director of Detroit Hives, with us on the Megacast, one of many Shared Detroit supported charities and nonprofits that may be joining us over the next couple of weeks as we approach Giving Tuesday. We'll be joined by a different charity supported by Shared Detroit Monday, Wednesday, and Friday at 10:20 a.m. In the case of Detroit Hives, you can learn more information, of course, at sharedetroit.org, but also on their direct website at detroithives.org. Learn more about their story, get in contact with them, shop at their shop, participate in fundraisers and activities, and of course donate to the organization as well. And so as we approach Giving Tuesday, this is a time of the year where people are eager to be giving to nonprofits and to charities, and to want to put their additional funds or put whatever they can give, either through volunteerism or financially, to help the betterment of our community. As we approach Giving Tuesday and this time of the year, how critical are the holidays usually to the next year over for organizations like yours?
It's very critical, especially during this time. Most people, they really are not really focused on bees, because the weather is changing. So it's really important to keep our minds on our pollinators, because honeybees, they do in fact still work over the winter. They're less active, but they still work to keep their hives warm. And they do this by clustering up and creating their own temperature. See, they regulate the temperature of the hive all year round. When it's too hot, they create their own natural air conditioner. When it's too cold, they create their own heat system by vibrating their wing muscles that creates friction, which is very exciting. And this is one thing that people need to know and understand the importance of that. So keep our organizations in mind, because we are looking for money to keep this mission going for the upcoming spring season. In addition to that, we create an earned revenue model to generate sales through our honey and through our products. So we're looking for people to support small businesses or small organizations like ours to ramp up our organization so that we become more financially sustainable.
We're joined by Timothy Paul, the director of Detroit Hives, with us on the Megacast. Learn more information about the organization by visiting the nonprofit's website at detroithives.org. Timothy, just another couple minutes with you before we'll say goodbye today. At this time, is there any other important information or things that our audience should be aware of in terms of your organization or other ways that they can help out that we haven't discussed today?
Absolutely. We're working to plan our second annual Winter Bazaar. Once again, it's an outdoor, fun, family-filled engagement activity that involves live ice sculpture, but also an opportunity for the community to learn about how pollinators survive during the winter. In addition to that, we welcome everyone to join the Hive. Follow us at social media at Detroit Hives, or visit our website at detroithives.org.
Well, Timothy, we appreciate you coming on and telling us about your organization, and wish you the best of luck as we head into this holiday season and into the future as well.
Awesome. Thank you, and be well.
I couldn't breathe at all. There was lots of talk about putting me on a ventilator. I thought I was gonna die. I was 39 weeks pregnant and had a scheduled C-section. During that time, I got COVID and was hospitalized for a month. I had a blood clot in my lungs. It caused me to go into right-sided heart failure. I was really scared. I kept texting my husband and my mom, telling them how scared I was, and I was worried that he was gonna grow up without a mom. And then I was worried if, when I did get home, that he wouldn't know who I was. Being 27 and a mom and a wife, and having that all almost taken away from me. It's scary. can. If a vaccine can prevent that from happening, why not? Get your vaccine. I don't want this to happen to anybody else.
A message from the staff of Michigan's Crime Victim Compensation Program.
Anyone can be a victim of crime
and suffer lasting trauma, physically, emotionally, and financially.
But you are not alone.
If you're struggling financially due to a crime,
we're here
for you.
Find out if you qualify for crime victim compensation.
Call 877-251-7373 or visit michigan.gov/crime-victim.
A message from the Michigan Department of Health and Human Services, Division of Victim Services.
If you are struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to a $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit or call toll-free at 833-511-0311.
A public service announcement from 89.3 Lakes FM.
You see certain things get reincarnated in your children. My daughter is very much inspired by my wife's artistic pursuits. So my daughter started making necklaces. She makes what we call affirmation fashion. I tell her every day that your black is beautiful. Your black is beautiful. Your black is beautiful. And if there's anything better than being beautiful, it's being smart. And if there's anything better than being smart, it's being kind. And reaffirming that every day is our method of making sure her chin never drops. My dad wasn't around, and I remember riding a bike and falling off and cutting myself, and me never just wanted to get back on it. People ask, how your children learn how to ride a bike, and you did. I didn't teach them. I just created an environment where they taught themselves, and all I had to do was be there.
Whether you're the city,
the county,
or the Huron River Watershed Council.
As partners working together to protect our water resources, we agree.
Pet waste is a source of harmful bacteria in the Huron River.
When it's left on the ground, it can wash into the storm drains.
These lead directly to our streams. No filters, no treatment.
Here's one thing we know that can help keep our water clean.
Pick up pet waste and trash it.
Pick up pet waste and trash it.
So pick up pet waste and trash it.
There's one water, and it's ours to protect.
Welcome back to the Megacast. I'm Tyler Kieft, alongside our studio producer and board operator, Calvin Brown, in our studios at Green Media Center on Walnut Lake Road in West Bloomfield. Although we're broadcasting all throughout the state of Michigan, learn more about all the places we broadcast live and live to tape, and find us on demand at civiccentertv.com/Megacast. Joining us now is Gerard Baltrusaitis. He is the JVS Human Services Career Counselor with us today on the Megacast, talking about the road ahead, the resignation economy, and explanation that will be live streamed on November 30th at 10 a.m. on the JVS Human Services Facebook page. Gerard, thank you for being with us today.
Tyler, thanks for the opportunity. Appreciate it.
Appreciate having you on. So tell us a little bit about this upcoming live streaming event on November 30th. It begins at 10 a.m. and it's all about resignation in today's workforce and economy. Tell us a little bit about what we'll learn on that live stream.
What we'll be doing is looking at generally what's going on in the economy. It has quite a few people perplexed. And we'll look at, again, the activities of what the economy is going through, and then look at it as far as how it relates to you. More specifically, what you can do as far as an action plan, how you can react to this, how it may apply to you, and again, what actions you can take.
And then in terms of people that may be considering resignation at this moment in time, what are some considerations that they should be making before they submit their courtesy 2 weeks or whatever the period may be that they may be required to or not required to submit to their current employer?
Well, there's an expression, plan your work and work your plan. I guess that's perfectly applicable here. No one should just go out and have a bad day at work and say, hey, I resign, and try to move forward from there. It's been done. It's not the best and optimal approach, but what you should be considering right now is, where are you in your life and in your career? Are you satisfied with what you're doing? Are you satisfied with your employer or the specific career track you're on? Evaluate that, speak to others, and then look at, if you were to quit, if you were to resign, what would be your next steps?
We're joined by Gerard Baltrusaitis. He is a JVS Human Services career counselor joining us on the Megacast. And then as you're building that plan, should you be consulting with a career counselor like yourself or someone else on your team over there at JVS Human Services? And what are some of those key questions that you should be asking of a career counselor in that consultation?
Sure. We do have career counseling services available here, as well as what we call ES, employee support services. That's a shorter version of career counseling. Again, to make a plug to other resources, it sounds like you're broadcasting throughout the state. There are the Michigan Work Centers that offer the career counseling services as well. And what you should be asking at these meetings are, what resources are available. Sometimes there are funding or money available for training, retraining opportunities. That's something to consider, as well as different career paths. What's recommended? Maybe you've given some thoughts to a certain career path or moving forward with employment in a direction. You can bounce that off these career counselors and see whether it might be something that has a future, so to speak, or that you might be skilled at. Some of the questions you might want to ask yourself, one is what I call the 3 Ps. That's purpose, passion, and proficiencies. You can look at, evaluate your current career, your current life, and see if you're satisfied. And if not, a direction, a way to find a direction is to evaluate, what do you enjoy doing? What are you good at doing? And is there a market out there for a combination of these two? And that can sometimes get you a little bit closer to a career path that would be more fulfilling.
We're joined by Gerard Baltrusaitis. He is a JVS Human Services career counselor with us today on the Megacast. We're talking all about resignation, both how it affects you if you are considering resignation and what you should be considering, as well as how it affects the economy as well. JVS Human Services will have a live stream a week from today, November 30th at 10 a.m. on the JVS Human Services Facebook page called The Road Ahead, the Resignation Economy, and Explanations. Let's talk a little bit now, Gerard, about the impact of resignations on the current state of our economy. What are some of the more common reasons that we're seeing of late why people are leaving their jobs?
Basically, I would say for the most part, it's a combination, but for the most part, it's a situation where individuals have said they've had enough. You can look at the lower end tier as far as employment is concerned in salaries, and those are individuals that feel that they've been kind of left out during this COVID experience, or they've been, for lack of a better term, used, whereas their employers didn't appreciate the services they provide and being on the front lines, all the way on up to mid-level or C-suite people that are in a situation where they're working and they're supposedly working flexibly, but they're sitting there at 60, 70, maybe even up to 80 hours a week, and they're saying there's a little bit more to this than the stress and the paycheck. I think what we'll do in reflecting back 5 or 10 years from now to this period, we'll see that this period of COVID provided a great pause in life for individuals, provided a situation where individuals reevaluated their life, where they're at, their careers, and what it means to them. And as a result, a lot of people have said, wait, there's more to life than just working, and that's a reason why we have so many individuals that are stepping back. Number I have is in August alone, 4.3 million people quit their jobs. Right now, I think I heard something like there were up to 7 million job seekers, but over 11 million employment opportunities. It's the first time in history that they've had this recorded that this has happened. And again, I believe it's a scenario where individuals are finally coming to grips with the fact that there is something beyond work, and that maybe I'm not going to make as much money, or it may not be the career ladder, but I need to fulfill my life. And as a result, I'm going to find something that's more suitable, more enjoyable for me.
We're joined by Gerard Baltrusaitis. He is a JVS Human Services career counselor, joining us today on the Megacast. Their virtual live streaming seminar called The Road Ahead, The Resignation Economy and Explanation will be happening at 10 a.m. next week, Tuesday, November 30th. So you can learn more about the resignation, the state of resignations in our current economy, why they've become more common, how they are actually working out that may be different than pre-pandemic or earlier on in the pandemic, as well as considerations that you should be taking into account if you are considering resigning. On the employer front, Gerard, because we do have a mass of people that are continuing to resign from their jobs, and there are plenty of open jobs, so they have options to go to. What should companies be considering at this moment in time to try to prevent resignations from an environmental standpoint, or from an incentive standpoint, or beyond?
Tyler, great question. Because I've spoke to several employers over the last several months, and they're a little bit frustrated. They've never seen a situation where they've had job openings and they raise salary opportunities, and they still cannot find employers or individuals to step into those situations. So what I would recommend to them, and again, this is a subjective standpoint, I'm not an employer, so it's easy for me to say, but to the best of my understanding, what employers should be looking at is providing a higher quality workplace. From the standpoint, we have records, we have data and information from the Gallup poll people. They did a lot of studies about 10, 20 years ago, and came out with information that more specifically leaned on the fact that productive employment, the most productive employers were individuals that had high quality workplaces. More specifically, there's something that's known in HR, human resource areas, as well as, again, some of the top companies, and they call this term employee engagement. And what they found is that the higher the employee engagement, the higher the performance and productivity in the workplace. And there's something out there that you can look at, and it's called the Q12 that the Gallup people developed. And this is a simple elementary test that they facilitate that measures the level of engagement that individuals have in an organization. And there's very simple questions. Questions such as, do you have a friend at work? Do you have the tools that you need to perform your job? Does your manager check with you on a weekly basis? Do you feel supported? Simple questions like that. And by managing these components, providing a workplace that has greater engagement or quality of work life, it's a situation where it may cost a little bit of money in upfront, but for the most part, it'll pay great dividends as far as performance and productivity in the long run. So my recommendation, again, to employers is to start getting the word out that you're an employer that cares about your people. You're an employer that individuals would be enjoy working for, and that I think would help. I'm not saying it'll alleviate everything, but would help to bring in more employees of a quality basis.
We're joined by Gerard Baltrusaitis. He is a JVS Human Services career counselor joining us on the Megacast, talking all about resignations. And so, Gerard, as we continue through this and as we're evaluating the state of resignations in our current economy, what are some common areas or common career fields right now that are experiencing some of this mass of resignations?
Good question. If you don't mind me, I've got a note or two. Okay. They said that switching for 20% of workers surveyed quit their jobs due to they're pursuing their past and passion. Says 25% of hospitality workers said they wouldn't want to work in the industry again. 20% of all workers in the pandemic caused them to change their roles. 13% of workers quit because their jobs didn't provide work-life balance. The areas where we're seeing probably, again, the highest amount of people resigning would, for the most part, be front-facing positions. Individuals in hospitality, individuals in customer service, individuals in hotel and restaurant, those that are front-facing as far as right up front with the people, with the customer. And again, a lot of the rationale behind that is that those are traditionally lower paying jobs, number one, and especially through this period of COVID, they not only are risking, to just coin that phrase, risking their lives from this standpoint of the disease itself, or COVID itself, but also a situation where they seem to be taking more frustration, or individuals are more frustrated, and as a result, they're not treating people on the front lines as well. So they're getting hit from both ends. They're jeopardizing their life and those of their family members by catching COVID, and at the same time you have the customers who are not treating people as well, and that's the primary thrust of the resignation. Although, again, as I mentioned, there are people at mid-level and so on that are also resigning because they're saying the amount of hours I'm working, it's not worth it either.
We're joined by Gerard Baltrusaitis. He is a JVS Human Services career counselor joining us on the Megacast. And so in terms of what you and your team of other career counselors over at JVS Human Services do, what kind of services do you provide that may be helpful to someone that's considering a career change at this time?
Once again, we provide career counseling and employment services. The career counseling is something that you can sign up for. It's it's provided on a sliding scale fee, and the counseling is pretty in depth. I think it's a total of 8 to 10 sessions over a 4 to 5 week period, but it's very thorough from the standpoint. You meet with a master's level individual that facilitates assessments, reviews your resume, looks at your job search process, helps you determine a career path, and that's pretty much a comprehensive, again, package and service that we provide. At a different level, some individuals, not everybody needs to do a remake, so to speak. We have employment services where you can speak to an individual once or twice and just share some of your concerns. They can evaluate your resume, provide a few suggestions regarding that, as well as some suggestions and tips regarding maybe interviewing or networking. So we do provide those services. And then coming in January, we're slating, it's not publicized yet, but we'll be offering a weekly workshop or a group for people that are experiencing the resignation economy, either those that are looking to transition and resign and try something else, or as well as those individuals that have already resigned and are looking for some assistance and a foot up and to understand their next steps.
Well, Gerard, thank you very much for joining us and telling us more about about the state of resignations in our current economy, why they're happening, who is participating, and what companies can do to create a better environment in their offices in order to retain their employees. Thank you very much.
Tyler, thank you.
Appreciate it. Again, the road ahead, the resignation economy and explanation will be live streamed on the JVS Human Services Facebook page on November 30th, and that's next week, Tuesday at 10 a.m. Again, next week, Tuesday, November 30th, 10 a.m. Live stream will be the road ahead, the resignation economy and explanation through JVS Human Services. We're going to take one more break, and on the other side, we'll be talking with Courtney Smith. She is the founder and CEO of the Detroit Phoenix Center. That will be coming up next. You're watching and listening to the Megacast.
Who is struggling right now?
I am.
My son is.
Many are struggling with anxiety, depression, and substance use. Before it becomes a crisis, reach out to MyCal, the Michigan Crisis and Access Line, for free confidential support 24/7. Available in the Upper Peninsula and Oakland County. Just call or text 1-844-44-MyCal or chat online at michigan.gov/MyCal. A message from the Michigan Department of Health and Human Services.
Motorcyclists are hard to see. To keep everyone safer, it's important to always look for them and know where most crashes occur. 84% of motorcycle and vehicle crashes happen on streets, not highways. And most crashes with motorcyclists occur when vehicle drivers are turning left. So before turning, especially to the left, make sure you look for motorcyclists. Then look again. It could save a life.
To Sophia and Gabriel. Even though these old knees can't follow on your adventure to the forest today, these flowers represent my love. These stitches and threads join us together. And wherever you see a flower, a bird, a beautiful tree, know that my love is with you.
Make the forest part of your story at a park near you. Find one at discovertheforest.org.
72.7% of high school students get less than the recommended 7 to 9 hours of sleep a night. This can cause pain, obesity, and can very negatively affect your mental health. When you have a consistent 7 to 9 hours of sleep every day, you get sick less often, lose more weight, and have better relationships with those around you. For more information about the dangers of sleep deprivation, go to sleepfoundation.org. This message is brought to you by the WBHS Digital Media Arts Program and 89.3 Lakes FM.
Can I ask you a question? Why did you get your kids vaccinated?
It was hard for them to social distance, to be isolated from their friends.
I want them to get back to school and sports games. So as a pediatrician, I recommend the vaccine to everyone I know.
The boys lost a former teammate and classmate who was only 20 years old. It's been a devastating year.
We want to get back to normalcy. Our daughter is really looking forward to being with her friends, being a kid.
It's the Great Lakes water. And so what people do ends up in our waterways.
Flushable wipes are just evil. They should be thrown away. They're impossible to destroy, and they can cause significant problems.
One of the main things when you're cooking is to not dump fats, oils, and greases down your drains.
They stick to the sides of pipes. They stick to everything they come in contact with. Don't put it down the sink.
There's one water, and it's ours to protect.
Welcome back to the Megacast. I'm Tyler Keefe here in our studios in West Bloomfield Township, although we broadcast all throughout Oakland County on a number of different television and radio stations supported in local communities, as well as all across the state on our website at civiccentertv.com, as well as on My Michigan TV. Learn more about all the places that we broadcast live and live to tape, and find all of our shows and interviews on demand by going to civiccentertv.com and clicking on our Megacast link. Joining us now is Courtney Smith. She is the founder and CEO of the Detroit Phoenix Center, a nonprofit organization responding to the needs of underserved and transient youth in Detroit. Courtney, thank you for being with us today.
Thank you for having me.
Appreciate having you on. So tell us a little bit about the services that you provide in your organization.
Yes, so the Detroit Phoenix Center, we're a high-impact nonprofit organization, and we provide critical resources, support, and a safe, nurturing environment for youth and young adults that are at risk of or currently experiencing homelessness. So we currently operate the only drop-in center for this population. They can drop into our center, take a shower, they can wash their clothes, they can access the food pantry, hygiene products, they can access a washer and dryer, and educational and life skills programming. So we have an after-school program where young people who are McKinney-Vento eligible will receive tutorial services and after-school enrichment that's club-based. So we have a theater club, a yoga club, and also mental health support. So we really provide wraparound supportive services for this population. We also have a youth action board where young people with lived experiences of homelessness and housing insecurity, they use their expertise and their lived experience to drive change, and they complete a service learning project at the end of their service, which they're paid to be a part of this board. We also have our COVID-19 Recovery and Relief Program, where we have been providing pandemic assistance to those who have been impacted by the coronavirus by providing rental assistance, by providing hotel vouchers, utility assistance, sporting goods, laptops, cell phone bill pay, and also actual cell phones to stay connected to the population that we service. Again, we provide wraparound supportive services, and we're focused on the whole person.
So, Courtney, when we talk about homelessness or we talk about housing insecurity, often children or young people can be overlooked in that discussion. It's more focused on the adults that may be experiencing these issues, which is also a concern, and their stories and their safety in these situations is vitally important, but we often overlook the youth angle on this issue as well. For context, in the Detroit area, just how many people that are classified as being youth are afflicted with housing insecurity or homelessness?
Okay. Yeah, that's a really great question. So when we're talking about young people experiencing homelessness, we're not talking about what you traditionally would think about when you're thinking of homelessness. Most people think about someone that is literally sleeping on the street. But when we define homelessness, we're talking about young people that are living doubled up. They're couch surfing, they're staying with family and friends, they're highly transient. They may not have, the proper utilities in their home, such as running water or heat. They may be staying in a shelter. They may be taking the bus back and forth at a train stop. Some may literally be sleeping outside or in tents. The living situations vary. In Detroit alone, there is anticipated that there are, just in the Detroit Public Schools Community District, between 11 to 14,000 students who are identified as experiencing homelessness, but haven't self-identified because the population is very transient and there's no one universal definition to define homelessness as it relates to youth. At our agency, we use the McKinney-Vento definition, which is based off of the federal government definition that defines young people that are experiencing homelessness living through multiple living situations, any place that's not suitable for human habitation, but it's definitely a hidden crisis and a very important issue that we as a community don't talk about enough, because young people that are experiencing homelessness, they blend in right in plain sight. Young people don't want to be seen, right? And so it's really hard to count the real number of the extent of it because they have to self-disclose in order for us to count them. So at the Detroit Phoenix Center, our motto allows us to be able to provide that support in a low barrier and confidential way that removes the stigma of a lived experience, such as housing insecurity.
We're joined by Courtney Smith, the founder and CEO of the Detroit Phoenix Center, joining us today on the Megacast. Learn more information on their website at DetroitPhoenixCenter.org. Again, that is DetroitPhoenixCenter.org. And so on a broad scale, what can our communities be doing to help prevent mitigate or, better yet, solve the homelessness crisis that not only affects Metro Detroit, but affects people all across the U.S.?
That is a very, very, very loaded question. And when we talk about youth homelessness, we can't talk about it with a silo issue, right? Like when we're talking about youth homelessness, we also have to think about social economic, right? Social stratification, disinvestment in our communities. There are so many things that contribute to youth homelessness. Black and brown youth are disproportionately represented within the homelessness space. When young people are exiting the child welfare system, they may not have anywhere to go, right? And so that contributes to homelessness. We just really came out of a pandemic where many people have been, financially, hit very hard. And with eviction moratoriums being lifted, there are more children and youth that are going to be experiencing homelessness as a result of experiencing homelessness with their families. So some of the things that folks can do in this situation from a very practical standpoint is, number one, raise awareness, right? Raise awareness about the youth homelessness crisis, get connected to agencies that are doing the work, to working directly with youth and families who are experiencing homelessness. There is definitely different advocacy efforts on the Hill, such as the Runaway and Children and Youth Act and the Human Trafficking Prevention Act. Some of those are ways also that folks can lean in and advocate for youth that are experiencing homelessness. If folks work in a school district, to be able to connect with their homeless liaison. There's a homeless liaison within every school district, and also connecting to agencies like the Detroit Phoenix Center that primarily works with this population. There are things that we need year round to be leaning in and to supporting in that way.
We're joined by Courtney Smith. She is the founder of Detroit Phoenix Center, joining us on the Megacast, the founder and CEO of Detroit Phoenix Center. And so, Courtney, you have an event that's coming up next week, Tuesday, November 30th. It's One Night Without a Bed, Sleep Out. Tell us about that event and what the goals are of that event, both for an awareness raising and for fundraising as well.
Yes. The One Night Without a Bed campaign is our annual end of the year fundraising campaign where we challenge our community to make themselves uncomfortable for a night so that a young person doesn't have to be. We're asking that folks will sleep anywhere but a bed, right? Many of us have the privilege to sleep in a bed at night. In our warm homes. Many of the young people that we service may not have that privilege. And so we're asking that folks, just as an act of solidarity and empathy, sleep anywhere but a bed, to sleep on the floor, to sleep on the couch, to sleep in the tent, to sleep outside, to raise awareness of the youth homelessness crisis. We're trying to make something that's invisible visible, and to share it on social media, to make a donation to the Detroit Phoenix Center so we can continue to alleviate youth homelessness and break the cycle of generational poverty within our ecosystem. And so the purpose of the campaign is to raise awareness of the crisis, to continue to support young people who are at risk of or currently experiencing homelessness. The funds will continue to allow us to provide hotel vouchers for young people who don't have anywhere to go during the holiday season, to be able to lean into prevention efforts by supporting with rental assistance, and also being able to bring joy to the young people that we serve year round to their faces by purchasing holiday gifts and just being a continued support to them. So it's going to help us to continue to operate and to provide support to that population. And so it kicks off with a live stream event on November 30th at 7 o'clock on our Facebook page, where folks will hear from young people who are in our program, hear the resilient stories, hear from them directly. We have Congresswoman Brenda Lawrence, who's going to be our keynote speaker. We have Josh Landon, who is our MC for the event. And then we have some other dignitaries, such as Kim Trent, and some of the youth, again, who cycled through our program to share their stories and to raise awareness. And so that kicks off the event. The campaign is a month long, so it's the end of the year. So it goes from November 30th all the way into December 31st. And so if folks want to participate, they can visit onenightwithoutabed.com. They can go directly to our website to learn more about it, and also to create a team, or they can participate in the challenge and join on social media.
We're joined by Courtney Smith, the founder and CEO of the Detroit Phoenix Center. Their upcoming event, One Night Without a Bed, on November 30th, although the campaign runs throughout the entire rest of this year. Learn more information in a couple of different places. DetroitPhoenixCenter.org. Again, that is their website for the organization at DetroitPhoenixCenter.org, or by going straight to the events website at onenightwithoutabed.com. Again, that is onenightwithoutabed.com. And so, Courtney, the Detroit Phoenix Center is also accepting in-kind donations of,
yes,
of items that are critical to supporting transient and homeless youth during this season and really all throughout the year as well. What are some of those items that are in critical need at this time that may be best to be provided by the community?
Yes, so we are definitely in high need of hats, scarves, and gloves, new coats, and also hand warmers for the population that we service.
We're joined by Courtney Smith, the founder and CEO of the Detroit Phoenix Center, joining us today on the Megacast. Courtney, just another few minutes with you today before we'll say goodbye. At this time, anything else that would be important for our audience to be considering about our youth and our homeless and transient youth, or other ways that they can help your organization and others that are working to mitigate or even solve this issue in our local area?
Yes, I would definitely say that it is a responsibility of our community to care for our community. And these young people are incredibly brilliant. They're incredibly resilient. And with the proper supports and investments, they are able to thrive. So if you're listening to this today and you're wondering how you can get involved, I would encourage you to reach out to us at DetroitPhoenixCenter.org. If you know of a young person who is in need right now that's experiencing a housing insecurity and need basic need support, they can reach out to us at 313-482-0916. Again, that phone number is 313-482-0916, and our website is www.DetroitPhoenixCenter.org. I thank you all for having me today.
I appreciate having you on as well. Thank you very much, Courtney.
Thank you.
Again, you can learn more information about the Detroit Phoenix Center organization, as well as how you can get involved and donate, by going to their website at DetroitPhoenixCenter.org, and learn more about One Night Without a Bed and how you can participate and sponsor as well by going to onenightwithoutabed.com. We're going to take one final break, and when we come back, we will wrap up today's show, give you some more information on what we'll be doing the rest of this week, and then wrap up this edition of the Megacast. That is coming up next. You're watching and listening to the Megacast.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
How can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources, call 211 or visit 211.org. 211. Get connected, get help.
We may come from different organizations,
but we work together to protect the Huron River for everyone.
Neighborhood storm drains carry water directly to local creeks and streams. No filters, no treatment.
Storm drains also help reduce street flooding when it rains.
So clearing storm drains and the areas nearby of trash and leaves helps keep them for rain only.
It is easy to do your part by adopting a storm drain.
Find a storm drain, check it, and clear it every month.
So keep storm drains for rain only.
There's one water, and it's ours to protect.
Welcome back to the Megacast. I'm Tyler Keefe here in our studios in West Bloomfield Township, where we normally broadcast Monday through Friday live from 10 a.m. until 12 noon. A quick programming update about our show the rest of the week. Obviously, we've got the Thanksgiving holiday on Friday, and we have Thursday. So we have both Thursday and Friday off. There will be no new Megacasts on that day. Tomorrow, a special edition of the Megacast. It will be shorter than usual, just 1 hour. We'll talk with the Share Detroit charity and another special guest as well, and the show will be only from 10 a.m. until 11 a.m. tomorrow. So that's just a quick programming note, but it will be on all of our regular outlets as is normal. That is going to do it for today's edition of the show. I want to thank all of our guests for joining us today to talk about a number of different topics. Courtney Smith, the founder and CEO of the Detroit Phoenix Center. Gerard Baltrusaitis, a JVS Human Services Career Counselor. Timothy Paul, the co-founder and director of Detroit Hives. Barb Giles from Jewish Senior Life, and Sue Selasky from the Detroit Free Press for joining us on today's edition of the show. You can watch all of our full interviews and individual interviews, as well as our full interviews and episodes on demand by going to our website at civiccentertv.com/megacast. Where you can also learn more information about all of our partnering television, radio, and web outlets. We have direct links to their website right there, so you can learn more information about everything else that they do outside of broadcasting the Megacast live and live to tape on their channels. You can also learn more information about COVID-19, including all the precautions you should be taking this holiday season to keep yourself and others in your family and across the board safe from COVID-19 by going to our coronavirus page at civiccentertv.com/coronavirus. There we have links from the Centers for Disease Control and Prevention, the Michigan Department of Health and Human Services, and the Oakland County Health Division, so that you can get a broad scope of information from a number of different experts at a number of different levels across our local, state, and federal level. Big thank you to our entire crew. Calvin Brown, our studio producer and board operator, with me each and every day here in our studio. Larry Nyland, our booking producer, and then Jared Clark, our Zoom producer, for being with us today and helping us out. Coming up next, it is Steve Leto Live, and then we'll be back tomorrow morning for a special 1-hour edition of the Megacast at 10 a.m.